Okay, everybody, I hope you did well on your test. We're going to talk about complications of wounds and injuries today. So one of the main things that happens with wounds is that they get infected. It is the most frequent issue we have with wounds, and that's just due to the fact that a wound is open. We have wounds come in contact with the environment, with other parts of your skin, with other contaminants that can cause infection. And that's just basically an invasion of a disease-producing or a microorganism that causes an immune response from the body. Tetanus is another issue. Now you guys need to know what tetanus is. It's an infectious disease caused by a bacteria found in soil, air, or skin, or feces, which is stool or bowel movement, producing a powerful toxin that has a serious effect on the brain and spinal cord. It causes severe muscle spasms along with many other issues. So please know what tetanus is. Signs and symptoms of a wound infection, you're going to see redness, swelling, and pain to the infected area. Now, when you first injure an area, you feel those things fairly quickly. That it gets red around it, it warms up. It swells. It's painful when you first have an injury, like a cut or a wound. And that's part of the normal inflammatory process. But after it's been treated, after you've been taking care of it, that should go away. It shouldn't feel hot to the touch. It shouldn't smell funny. It shouldn't have purulent or pussy drainage. It shouldn't have green drainage. You shouldn't have fever or red streaks. And if any wound that has red streaks radiating from it in any direction, especially towards the heart, are very dangerous and need to have medical attention. That generally means that the infection has definitely spread to the bloodstream. Other signs of and then signs and symptoms of tetanus. Now you would know what that is. You would need to know what that is as well. Frequent muscle spasms that we talked about, and then body rigidity. Basically, there is all of the muscles in the body spasm at one time. It causes significant pain, along with, like I said, a multitude of other issues. There's no way to cure tetanus. That's why anytime you get a tetanus shot every 10 years. And then you also should get one if you get any kind of injury or open wound and you don't remember when you had your last tetanus shot. If you don't remember and it's been 5 years, it won't hurt you. Having an extra tetanus shot won't hurt you, or tetanus vaccine. It won't hurt you. It'll actually just help prevent that tetanus. Okay, so I want you guys to read through this one and think about it and be prepared to answer those questions. You may see it again. You may see it as a bell ringer this week. So I would take a minute, read through that, and be sure you know how to answer those questions, okay? Bandaging. We're going to talk about dressing wounds now. A bandage holds the dressing in place. A dressing is actually what is placed directly onto the wound to control bleeding or prevent contamination or to maybe actually help with healing. Not all dressings are sterile. Some are, but they don't necessarily have to be, especially in an emergency situation when you need to stop bleeding. You want it to be as clean as possible, but you may not have a first aid kit with sterile dressings. Now, once we do dressing changes for you, or you do them as a medical professional, we do use sterile products. We don't use products that have been opened on a clean wound once we've cleaned a wound. So you want to make sure when we can, and if you have a first aid kit, use those products to prevent infection or increase contamination. But if you need to stop bleeding, you just use whatever you have to hold pressure on it. Roll bandages. So these are things that you guys are pretty familiar with. There's several kinds. There's roll gauze, ace wraps, and then also there are roll bandages that are used to hold a cast in place, or fiberglass dressings. They're going to be a long strip of material that basically they come in everything from a 1/4 inch all the way up to 5 inches, I think, 5 or 6 inches. I think some of them are. Some of the things that we see that we use rolled gauze with is those are usually used to hold something in place, like other gauze, dressing materials, like sometimes we put ointments or things into a wound to help with infection. Sometimes there'll be a bacteriostatic kind of dressing, and that just keeps your own it holds any of your own normal skin bacteria. It keeps that from getting into the skin, into the wound. So it's going to, roll bandages are always going to hold something in place, either a dressing or maybe using them to make a splint. If someone has broken their wrist and you need to secure that because they're going to have to maybe walk back a little ways before they can be treated, you can use sticks. You can use them a lot of things just in your area, but you want to take something, a roll dressing, and or if you can, a shirt or something to secure that in place and keep it from moving. One, because it's very painful. Two, because you could do more damage. So you want to be sure that if you have things available to splint with, that you do. Triangular bandage. So that would be something that we think about when we think about splinting. Like an arm sling, if you've ever dislocated your shoulder or maybe even broken your arm where they had to do a cast above the elbow, for a little while you may have had to wear a sling. Also, sometimes when we dislocate a shoulder, we'll not only support that arm in place with a sling, we'll also wrap a dressing or whatever we can to keep the arm really close to the chest wall to keep that shoulder from moving. You can also use triangular bandages to splint ribs. You can't really fix ribs if they're broken. There's not a lot of comfort, but you can apply a small amount of pressure, not a lot of pressure, but a small amount of pressure to support the chest wall when breathing, using a triangular bandage or a circular or a bandage that would go around and hold that dressing close to the body. Hold that limb close to the body. Remember, just like when we talked about putting a Band-Aid on or anything else earlier, we want to make sure that we know when we put a bandage on anyone, we have to be able to know what's going on, that their skin stays pink and it's not causing more pain, and that they're able to move either above or below the injury, depending on where the bandage and the dressing in the wound is or the need for the dressing is. Make sure that it's secure enough to keep it in place, but not to cut off circulation, not to cause the skin above and below it to be kind of a bluish or a pale color. We want to make sure that they can still move it. And unless it's a finger or a toe injury, leave those open. Make sure that they're able to move their fingers and toes, because we can check for those nail beds to be pink to look at circulation. And that's very important that we do that. We make sure that whoever we're helping, they have circulation available. You want to wrap towards the heart as much as possible, but just because it helps with circulation. And then when available, we're going to use the figure 8 roll technique. And I'm going to show you a video of the figure 8 dressing technique. Give me just a second. Okay, I'm sorry, everything is running slow today, so give me 1 second. And tap. All right. Well, maybe. Oh, let's do dressing, not rolling. I'm sorry. Okay, well, let's look at a figure 8 wrap here.
Figure 8 wrap. With foot flexed at 90 degrees, start the bandage at the center of the ball of the foot with the lower edge of the bandage at the base of the toes. Wrap either lateral or medial using 2 turns around the foot to anchor the bandage. Continue to wrap the foot and then proceed up and around the ankle, covering the Achilles tendon. Return over the ankle and down to secure the heel. Continue up the leg for 1/2 turn above the ankle. Come down over the tibia to form the first figure 8. You'll notice as you do this up the leg, you'll see a crisscross pattern. Bandage up the leg in an alternating up and down pattern by overlapping bandage by 50% with 50% stretch. Continue on until you reach about a 1 inch below the knee. Cut away excess bandage, secure with tape. Remember to always consult the product information sheet that came with your bandages to ensure correct application.
So as you guys can see, when you do a figure 8, you look like you have a crisscross pattern. That is something that's very important. And as you saw, she started at the base of the foot like you would start at the hand as well and work your way up, or the wrist and work your way up. You don't want to start at the top of the arm or the top of the knee and work your way down, just because of how it impacts circulation. All right, let me get our slides back open and we will keep rolling. Now, we are moving into part 3. We're going to talk about injuries to specific area of the body, fractures, joint injuries, muscle injuries, and how to take care of those. I will tell you as we move on, you are going to see some pretty graphic pictures, but it kind of helps you correlate how severe and how serious they can actually be. So skull fractures or open fractures, especially to the skull, can be very, very dangerous. Basically, an open fracture is where you can see the bone coming through the skin. It usually is visible, but sometimes you can just see it protruding up. Closed fractures are basically an indention or a fracture that you cannot see through the skin. That's the difference. An open fracture you can see through the skin, a closed fracture you cannot. Head trauma. Head trauma is a big thing that happens in motor vehicle accidents, with falls, and with other types of sports injuries, other types of injuries relating to fights or abuse. So we do see skull fractures most often, though, with falls, motor vehicle accidents, or when something has fallen on someone's head, or their head has been hit by something. Signs and symptoms of a head injury. It's very painful to the spot. They may have an indention or a deformity in the area where there's been damage. They may have a clear or a yellowish drainage coming from the ears and the nose. That's very serious. That's cerebrospinal fluid. That is the fluid that keeps the brain kind of floating around in there. They may have unequal pupils, which means one of the black areas of their eye, their pupil may be very large, and the other one may be very small. If any of those things, you see any of those things, that is very serious and needs treatment immediately. And you need to make sure that their head and neck are secure, and that they are not moving them any more than not moving their head and neck. Those are very, very serious injuries and need to be treated immediately. Concussion. Now, concussion generally is temporary. It's a temporary impairment of the brain function due to an injury of the skull. We see lots of concussions in sports injuries. Sometimes they're related to falls or other issues. But a concussion, generally after a week or so, they generally go back to normal, to feeling fairly normal. And with a concussion, some of the signs and symptoms are, like I said, a blow to the head, motor vehicle accident, industrial accident, being hit by a weapon, sports injury. What happens in a concussion is when it is a force that makes the brain kind of bump the front and back of the skull that causes a kind of a bruise to the brain. That's very different than shaken baby syndrome. Shaken baby syndrome is very severe and can cause death in infants. And that is basically someone who has shaken them severely enough that they have some bruising, they have definite bruising and some bleeding in the brain. It can cause tearing of vessels anywhere from behind the eye all the way to any part of the brain. Symptoms of a concussion, generally, not always, but sometimes they have a loss of consciousness. Most of the time they do have a severe headache. They won't remember how they got hurt, or they won't remember anything right after when they get to the emergency room. They'll see sparks, or they'll say they see stars or black spots in their vision. Generally, they're very dizzy when they try to get up, especially the first time. They may stumble and fall back down. They'll have visual disturbances, either seeing double vision or blurred vision, and can have vomiting. Anytime anyone has a head injury with vomiting, that's also a reason to take them to the hospital to be assessed, because they could have a brain bleed. So if someone has a concussion or has any kind of head injury that vomiting is induced, we want to try to be sure that they get seen by a physician and probably get a CT scan to make sure everything is okay. There are 3 different degrees of concussion. Mild means no loss of consciousness, and generally their symptoms are fairly mild and go away within a day or so. Moderate concussions, they lose consciousness for less than 5 minutes. Their symptoms are more severe, and they may have an episode of vomiting with that, and may not, but will have that serious headache, the dizziness, all of those kind of things. A severe concussion is when someone is unconscious more than 5 minutes. Anyone who is unconscious 5+ minutes needs to go to the emergency room. There's no way to tell just by looking at someone how severe a head injury is. So we need to make sure that anyone who experiences a concussion is seen, just to make sure there's no real damage. A brain contusion, that is a bruise on the brain. It's very serious. It's called a hematoma, and it's correlated to wherever it is, whether it's a subdural hematoma, whether it is an occipital hematoma. Any bruising of the brain where there's actually blood collection, like a bruise on your skin, but it happens to the brain, is very serious. Generally causes pressure on the brain. Many times they have to bore holes into the brain to relieve pressure. They put them on a specific medication called mannitol, and then they monitor them until their intracranial pressure is back to normal. So here's a brain contusion. As you can see there on the left, where it has actually put in pressure on the brain. This is a view of the top of the brain, just below the skull, and the space between the skull and the brain. There's minimal space anyway. And whenever there's bleeding in that space, like I said, it puts pressure on the brain and can cause the brain to try to slip through the big opening at the base of the skull where the spinal cord feeds into the brain. So it's very serious. It can cause the brain stem to collapse. And the brain stem is what controls all of our vital signs. Oops, sorry. Okay, so now you're seeing a subdural bleed, and that takes place between the brain. Takes place within the brain, often results in stroke-like symptoms, where the patient may lose, if it's on the right side, they may lose some function of the left side of their body. They may have speech issues. They may have vision changes. Many things can happen that cause changes their functional ability if it's treated quickly. If it's not treated quickly, like I said, it can cause the brain to try to make space and push its way down that opening at the bottom of at the base of the skull, and cause the brainstem to collapse, and then there's no more vital signs. So once the brainstem is gone, we are physically brain dead. Epidural bleeds, it's initially below, it's usually due to an initial blow to the head, generally with a brief period of unconsciousness. Once again, very similar symptoms you're going to see. This epidural bleed is very similar to a concussion, with the exception of the unequal pupils. So we have to make sure that anyone who has a head injury gets seen. They'll see stars, or they'll see sparks or spots in their vision, headache, dizziness, projectile vomiting, visual disturbances. And the thing with an epidural bleed that is so scary is that might happen initially, and then they may be okay for 4 hours or for a day or so, and then all of a sudden they just collapse and they're unconscious. Generally, when that happens, people pass away because they've had a slow bleed in their brain the whole time since their head injury. So we want to be sure that we watch them. And then anytime, once again, if there are unequal pupils, we need to have them seen immediately. How to treat a head injury? We think if someone has a head injury, we also consider that they have a neck injury. So when we do our airway breathing and circulation, we use the jaw thrust maneuver that you saw early on. We cover any bleeding, but we don't plug the nose or the ears because that is pressure relief happening. We call 911. Once again, if anybody is unconscious 5 or more minutes, we always call 911, and we always assume that a head injury has a neck injury to go along with it. So, or a face injury. If someone gets and I've seen this happen in softball, a pitcher takes or baseball, a pitcher takes a ball back to the eye or to the face, and it breaks facial bones. We want to make sure that they get seen as well, and we want to treat them like they have a neck injury because we don't know for sure. Complications of a head injury, they once again need immediate attention. Headaches may, especially if a headache lasts more than 48 hours. Nausea and vomiting of more than 2 episodes. So if they get their head hit and they immediately vomit, I would say if they vomit again about 4 hours later, they still should be seen, even if they're still awake. They may feel very drowsy, very tired. So when they are, we want to, every couple of hours, we want to wake them up and just make sure they know who they are, and that they'll look at you and talk to you and it makes sense. They may have blurred vision, double vision, or just really blurred vision. They won't be able to walk a straight line. They'll have difficulty getting up and down, getting real dizzy. They may not, what they say to you may not make sense. And in severe cases, they can have, or the severe blow to the head, they can have a seizure related to the head injury. So be sure you remember the complications of head injuries. Eye injuries. Let me look and see where we are on time. Okay, we have time to start eye injuries. Eye injuries are also considered very serious. Any injury to the head or face we consider serious. And we want to get it treated as soon as possible. Eye injuries can be very dangerous because people can lose vision. Plus, you have arteries and vessels behind your eyes that can bleed into the skull. So that's very dangerous as well. Blunt injuries are caused by trauma, generally. A blunt injury, remember, is where there's a bruising, but there's no open area. Lots of swelling. It can be related to fights. It can be related to someone getting hit with a softball or a baseball, basketball. They can get. I've seen people have injuries related to, rocks being thrown from a vehicle, or we're in the farming community, so very often people be building fence, and one of the staples that they put barbed wire up with will bounce out, or a nail will bounce back and cause an eye injury. Doors, anything that could hit them in the eye, it could cause blunt trauma. We want to have the victim lean back. We don't want them to sit straight up or lean forward because it causes more pressure and increases bleeding. We want them to close both eyes because it's really hard to leave one eye open, and when you blink, you still have some movement of the other eye. We want them to try not to move the eye any more than possible. We want them to relax, keep both eyes closed, and not try to tell them not to move their eyes around in their head. And we want them to get medical attention quickly. We don't want to add any pressure, so we don't add any kind of weight to the eye. So we don't put pressure on the eye. We don't put pressure, and we don't put ice on the eye just because of the added weight. It can cause increased issues. Penetrating injuries. I've actually seen not a staple, but a fish hook in an eye. So penetrating injuries are when something actually goes into the eye and causes damage. Once again, we're in a farming community, so we see lots of welding injuries to the eye where slag will get in the eye. But it can be pens, pencils, knives, ice picks, bullets, roofing staples, pool sticks, just pieces of wood. People chopping wood, they'll get wood in their eye. Like I said, slag from welding, all kinds of things. We have all kinds of fish hooks that get into the eye that cause a penetrating injury. Once again, if something is sticking in, we don't pull it out. We always just go and seek medical attention. With this, we want with eye injuries, we want them to sit in a semi-upright position. So we want them to kind of be leaned back where there's not any excessive pressure on the eyes. We want them to close both eyes and to try to relax and not move their eyes around. We don't apply any pressure. If we need to, anything that's penetrating, if we need to secure it because the person can't close their eyes or because they keep blinking or because we're afraid it'll come dislodge, we can secure it, but we don't add any pressure. One of the ways to secure some things are like with a part of a styrofoam cup, and then we tape it actually to the head. We put the big styrofoam cup over the eye. We want them to be sure if they can't see, we need to cover both eyes just to, tell them what we're doing. We have to cover their eyes, have them close their eyes. Please don't do anything to them unless you tell them what you're doing. So, if you're going to cover their eyes, say, okay, I'm going to cover your eyes now, or I'm going to secure this in place. I'm going to use a foam cup. I'm going to tape it to the other side of your nose and to the side of your head. Tell them what you're doing. They're already scared enough. And now they can't see. So you want to tell them what you're doing. Tell them where you are. Tell them who you are. Tell them, just keep talking to them very calmly. Don't be excited. Don't be anxious. Don't let them know you're scared, even though you would be. Just talk to them very calmly so that they stay calm. For other foreign objects, splinters, metal, dirt, dust, rust, pencils, pens, glass, anything like that, we need to treat. We need to tell people not to rub their eyes. We need to flush it with water if we can until the object is free. Now, like I said, with slag, generally it's kind of burned into the eye and we have to go in and burn that out, a doctor would. If we can remove dust or a splinter that's in the corner of the eye or a fleck of dirt or anything like that, if we can remove it very easily with leaning the eye forward or inverting the lid, and using a Q-tip or flushing it anyway, we want to try to remove it if we can, if it's not embedded in the eye. If it's embedded in the eye or it's penetrating the eye, we don't do this. This is only when something's in the corner, like an eyelash or dirt or something. We want to flush it, and we want to keep them, we want to tell the patient always what we're doing. If we can't get it out, we want to go ahead and have them close both eyes, just like in every eye injury issue, and take them for medical attention. Once again, the reason why we have patients close their eyes both eyes when they have any kind of eye injury is we want them to move it as little as possible. We also don't want them blinking, which can make it more serious, cause more damage to the eye itself. So we want to make sure that we are just as calm as possible. We explain to them everything that we're doing, and we have them keep both eyes closed and ask them not to move their eyes, to try, not to move their eyes at all. Once again, we don't remove an embedded object. We can place a paper cup over a short object like a pencil or a knife or something like that to keep it from moving around. Cover both eyes to reduce movement. Medical attention immediately. And once again, explain to the victim what's going on, who you are, what you're doing, and what's going on around them. If they hear loud noises, they're going to tense up. So tell them if they may be going to hear something loud, or tell them where they're going. Don't make them be more afraid than they already are. Okay, we are going to talk about chemical burns tomorrow. So everybody have a good day, and I'll be back with you later. Thank you.